Hello, and welcome to Assessing Palliative Care Needs. Today, we will be looking at what makes a good assessment, an overview of a good pain assessment, reviewing symptoms, and starting to develop a management plan. I would like to credit Pepper for some of these slides, and if you would like more in-depth Pepper education sessions, you can submit an expression of interest to them via their website. I would like to start, first of all, by briefly touching on what palliative care is. You can see here the World Health Organization definition of palliative care. The goal of palliative care is to achieve the best possible quality of life for patients, their families and friends. Palliative care provides relief from pain and other distressing symptoms. It affirms life and regards dying as a normal process. Palliative care integrates the psychological, emotional, spiritual, and social aspects of care for the patient, the family, and close carers in a culturally sensitive manner. Palliative care offers a support system to help patients to live as actively as possible, and also to help family and carers to cope during patient's illness and after the patient's death. Palliative care uses a team approach to address needs of patients and their caregivers, and if at all possible, avoids futile interventions. It is important to keep these aims in mind when assessing a resident's symptoms and offering a plan of care. In the context of the older person, palliative care can present as a chronic condition. The chronic condition itself might not appear to be the cause of death, but actually decreases the person's ability to fight off things such as infections like pneumonia, UTIs, or influenza. It's important to report any concerning new symptoms or deterioration in condition to the nurse in charge. As always, documentation is very important at all stages of care. We will go into more detail today about performing a physical assessment of symptoms. So you've identified a need and assessed the problem, and now you have to make and document a plan. This plan will also need to be reviewed for its effectiveness regularly. Symptoms are multidimensional. They can have multiple causes and effects. People with life-limiting illnesses can experience a number of symptoms concurrently. Interventions can be targeted to alleviating the cause, while at other times, interventions can focus on alleviating the effects of the symptom. Interventions should be based on the best available evidence. Management of symptoms often require a multifaceted approach. Management should be consistent with the person's goals. Only make one change at a time. Otherwise, you won't be able to assess what is working for the resident. Pain is often the most feared symptom for people with a life-limiting illness and their family. Pain is a very personal experience, and the individual's description must be believed and acknowledged with an assurance that the health professional will work to relieve their pain. Pain can be caused by a combination of factors, including the underlying disease, complications of the disease, such as a fracture secondary to bone metastases, some treatments, such as neuropathy caused by medications, and other comorbid conditions like rheumatoid arthritis. Assessment using knowledge of the person's underlying disease, together with a person's description of their pain, is required to identify the appropriate plan. Here we have a commonly used pain assessment tool, the PQRST tool. You have here P, which is provoking factors. So what makes the pain worse? What were you doing when the pain started? Quality, so a description of the pain and its characteristics. Region and radiation. Where is the pain and does it go anywhere else? The severity. This may well be recorded on a pain scale. We will talk about pain scales in more detail shortly. And timing. So how long have you had the pain? And does anything make it worse or better? Is it intermittent or constant? What is it that the pain stops a person doing in their day? What is the meaning of the pain to that person? And what is the person doing to cope with the pain? Pain location is important for assessing the underlying cause and type of pain. Severity is the most common dimension of pain assessed in practice. Here we have a selection of commonly used scales, including numeric ratings, ranging from 0, no pain, to 10, severe pain. The meaning of severity scores can be varied between individuals, but they can be useful for comparing change within that individual over time. It is important to have a system in your facility to report and track symptoms. This counts for pain, but also other symptoms reported by your resident. This reporting will allow you to see the pressing issues, but also evaluate the effectiveness of changes to care. It is important that a plan of care is in line with the goals of care of the resident. It's also important not just to have a score of severity from a person, to actually get some idea as to the quality of the pain. Here is an example of some words that somebody might use to describe what that pain feels like for them. A dull and aching pain is often associated with a nociceptive pain, whereas a burning and tingling pain can be associated with neuropathic pain. Understanding the contributing factors can help to identify the causes of pain and the ways to prevent that pain. Understanding how pain interferes with the day-to-day function can help to identify interventions used to reduce the impact of that pain. Pain assessment in people with cognitive impairment presents a particular challenge. Non-verbal signs that have been suggested as being helpful in assessing pain include vocalization, like groaning, whimpering, facial expressions like grimacing, changing in body language, behavioral changes, perhaps increased confusion or refusing to eat, for example, physiological changes like increase or changing in blood pressure and pulse outside of the normal limits, and physical changes like skin tears or previous injuries and evidence of that. Additional clinical investigations may be undertaken to identify the cause and guide appropriate treatment of pain. Decisions about the investigations are based on the assessment of the individual's goals, wishes, and expected beliefs. It wouldn't be unreasonable, for example, to expect that somebody may not wish to go to a tertiary hospital to have a CT scan to further investigate their pain. And if that is not in line with their goals of care, then that is an acceptable decision to make. A combination of treatments, including pharmacological and non-pharmaceutical interventions, should be considered. Common concerns of people with pain may be pain is an inevitable part of their disease. They might fear that the disease is progressing. They might fear addiction from the medication or side effects. Assure the person that health professionals are continuing to assess their pain and work with them to provide comfort. We will look more in depth about these other symptoms in future sessions. The assessment philosophy is the same. We need to establish an idea of the cause and quality of the symptom if we're going to have a chance at managing it. And as always, document everything you do. So just to summarize the key points, focus on the experience of the patient and their family, not just the underlying pathology of the symptom. Focus should be on patient's goals. Involve the patient in the treatment plan. consider a multifaceted intervention and a team approach, and document everything you do with your patient. Thank you very much.